Hi, it's Jenny with KOSI 101.1, and we are celebrating October. If you're like, what is that? Well, October is, of course, Breast Cancer Awareness Month. So on Mondays, we're calling them Mammogram Mondays. We want to remind you to get the mammogram. Early detection is key. And to bring you on, we have the doctor. You might have seen her on 9 News. And remind me again exactly how you say your name.
Dr. Pyle Coley.
Pyle Coley, okay. Because I'm terrible at that. I probably will still say it wrong like 4 or 5 times. If it makes you feel better, I get my kids' names mixed up as a little bit too. So it's all good.
Well, it's funny. I tell people that we had Dr. Coley, we had a Dr. Nordstrom in our hospital too. So I'm like, Cole's a department store with an I. And he was Dr. Nordstrom. So I didn't think it was fair. But
yeah. You're like, wait a minute. I kind of like want to be Nordstrom's. Yeah. Well, thank you, Dr. Coley, for coming on for sure. And so let's start with like how some of these breast cancer diagnoses happen, because it's like 1 in 8 women in the United States are diagnosed with breast cancer, and the screenings are kind of different for all different types, right?
It is very different, Jenny. And it's the breast cancer that's going up in the young people that has me the most worried. Now, we don't understand why breast cancer is going up. In fact, lots of different cancers are going up in young people. We think it's environmental toxins and such, but that means we have to have our eyes and ears up for early screening. And the guidelines keep changing, which confuses people. So here's the recipe I want an average risk woman to remember. And we'll talk in a minute about what high risk might mean.
Okay.
But if you don't have a family history, don't have a gene mutation, you've never had a breast biopsy, kind of an average risk woman, most of us should start screening at 40 and get at least a mammogram every year. Okay. Now, the FDA has now just updated guidance just a few weeks ago, in fact, which was game-changing, which said if you get a mammogram, it must say on there not just whether it's normal or not normal, but how dense your breasts are. Because if you have dense breasts, you're looking for a white cancer on a white background.
Oh.
So it's white on white because you have all this dense breast tissue. You can't see it.
Yeah.
So now your mammogram's actually going to have a statement talking about breast density, and 50% of women over the age of 40 have dense breasts.
Yeah.
So those women, mammograms don't pick up cancers. They actually need supplemental screening with either an MRI or an ultrasound.
Oh, okay. And so that would be something where the doctor would say, hey, this is very dense. And then they'd want you to go in and get the ultrasound same day, or if possible, like just to kind of make sure if they can't see it clearly.
So they need a second technology to look, but sometimes your doctor might not say it.
Yeah.
So this is why I want every woman to look at her mammogram report. Don't just read the part that says normal, no cancer detected. Yep. Read the density. And now your breast density, you can't tell by feeling.
No.
You could have big breasts, little breasts. You can have dense breasts regardless of size, and your breast density can change over your lifetime.
Yeah.
So if you lose a lot of weight, you lose fat, your breasts can actually become more dense. If you're on hormone therapy, that can change your breast density. So having not just knowing, that your mammogram's normal, but knowing what your breast density is every single year when you get that is actually a real clue. And I would say there's lots of other clues in your mammogram. Sometimes you can have something called breast arterial calcifications, which is tiny little calcium deposits in the arteries in the breast.
Yep.
Well, guess what? That's a predictor that you might go on to have a heart attack 10 or 20 years later.
You're like, okay.
So your mammogram really gives you a lot of clues. So I want every woman to start reading her mammogram reports and talking to her doctor about all the components in there.
And that's one thing we've talked about is like being your own advocate too. And I feel like a lot of us, especially during COVID and things like that, we were all kind of settled down. We didn't want to go, or we put off things. And it's very scary to do that. Like you should not put it off. And when you go, know the questions to ask. I've actually done this before where when I go to the doctor, like I write down the questions that I want to ask, because sometimes when we're sitting there, like we get a little flustered with them. We're like, oh, maybe they're like short on time or whatever else. So I make sure that I write on a note what I want to ask so that I can like remember when I'm in there and like the doctor's asking stuff. And this is stuff, I learned like I had an irregular one. And so that's why I go every 3 months. And it was the density issue and being able to see. And when they call you in for that ultrasound, it can be scary. But if you know going in that this is something that you're probably going to need because you know that they're dense, or because you know that this is a procedure that might be better detecting that.
For sure. And I want to ask you, do you do breast self-exams?
Yes, I do.
Okay.
Yes.
So, breast self-exams, I would say, are a good idea, even though the guidelines don't formally recommend them. And you should do them at the, same time every month after your period, because they help you know your breasts.
Yep.
They help you know what your breasts are changing. Now, keep in mind, for you to feel a lump, it has to be the size of a pea or greater.
Yeah.
And so by that time, it might even actually be too late. But if you have abnormal pain, abnormal nipple discharge, just even abnormal texture of your breast without without even feeling a lump. These are all things you want to write down and talk to your doctor about.
And you have, I mean, you know your own body.
For sure.
The doctor, you know, they might have a 15, 20 minutes in there with 30 minutes, whatever it is. But like, you know your own body. So like, I'm a big advocate for that. Like my grandmother had breast cancer. Like it's always been something we talked about in our family. But I don't think a lot of families know that about their grandparents and stuff like that, because hereditary genetics, yes, that can be a part of it. But sometimes it just feels random. You don't have a reason why.
And that's what we're seeing. We're seeing a lot more no family history type of de novo cancers. And there's certain cancers, Jenny, that you can't even feel. You can only pick up on a mammogram. And so imagine, like, you know, if you don't get that mammogram or you put it off, that breast cancer, which is curable when it's what's called in situ, meaning it's kind of localized, it hasn't, you know, invaded yet, it's completely curable. And you lose just a little piece of tissue. But if you wait a year or put off your mammogram for 6 months or 12 months, it could require more breast tissue to be removed. It could require mastectomy, lymph node dissection. So, you know, you're trading a small problem for a big one. And I think for me, breast cancer screening is a way we as women can empower ourselves to take control of our health and to be smarter than the disease.
Yes.
Because we know it's the second leading cause of cancer death among women. We have to change that.
Yes. And don't be afraid to go in, like, you know, say you go and you feel something, don't be afraid to go to your doctor and have them tell you it's nothing, because actually that's great news.
Right.
But at least you are being smart enough to notice your body, to recognize when something is a little different or off. And majority of the time, hopefully it'll be nothing, but you can't be scared about kind of feeling foolish on that point. I don't think that should be a thing.
No, and embarrassment, because people get embarrassed about talking about their breasts. So I would say not even just feeling, but even how the breasts look, because there's a type of breast cancer that almost looks like an eczema. It's called inflammatory breast cancer on the skin surface. And you might just think that's from your bra or an irritation from something else. But when you do your breast self-exam, you want to start by actually looking, standing in front of when you do your breast self-exam, you want to start by actually looking, standing in front of the mirror, looking at the breast, raising your arms up above your head, making sure that they're symmetric, there's no skin puckering or anything like that. And then you want to do that feeling going all the way up into the armpit, because our breast tissue actually extends into our armpit as well.
And where exactly is like a good, like, kind of like tutorial or like information where they can get it? Is it like breastcancer.org or?
The American Cancer Society has a number of great resources that you can kind of think about, not just your risk, but also, you know, how to do a breast self-exam. One thing I definitely want to mention is this calculator. And so every single woman needs to go on this website. It's a breast cancer risk calculator, predicts your lifetime risk of having breast cancer.
Wow.
And that will dictate when you start screening, how often you screen, which modalities you use to screen, meaning just mammogram, or would you add MRI and, you know, ultrasound as well, and whether or not you need, you know, any other additional preventive measures. So it's an easy calc. Just Google breast cancer risk calculator.
Okay.
And put in all of your information.
Okay.
And it calculates and spits out a personalized risk score. And if you're above 20%, you have to get on top of talking to your doctor. And I'm talking about women even in their 20s and 30s.
Yeah.
Because we often think, oh, it's an older woman's disease.
Yeah.
Let me wait till I'm 40 or whatever to start having that conversation.
Yep.
But if you had a family history, you might have a mutation, you have other risk factors, like you've never carried a pregnancy or you've been on hormone replacement therapy like birth control pills for many years. Talk to your doctor. Does it make sense for me to get screened earlier? And they're going to ask for this risk calculator, and then you guys can sit and have that conversation.
And you'd be like, hey, I already did it. Look at me. I did the homework. I'm good. Because I feel like that's kind of what it is when you're thinking about your health, is doing the homework, doing the research, and just, again, being your own advocate. They're not going to know anything you're not going to tell them. So if you recognize something or if you feel like something's off, I feel like you should always listen to that intuition. Women especially have really good intuition. But it's not just a women's disease. Men have it as well. Our very own Murphy is a survivor and a warrior himself. And I feel like that's one of the things too with guys, is they just don't want to go get, like, they feel like it's a girl thing. It's not a girl thing. We all have breast tissue.
Actually, I lost a dear friend to male breast cancer. He was a vascular surgeon, and he was operating, and he felt a little pain in his armpit, and he thought it was from operating all day, and turned out it was this, you know, aggressive breast cancer in men. So 1% of breast cancers do occur in men. And to your point, we cannot be embarrassed to talk about it and think about our men just as much. And so even men, I think, should have a sense of what their breast tissue looks and feels like. Because if they find a lump, and we don't encourage our men to get screened because it's not effective on a population level, but it's important important to know your body to really know if there might be any kind of signs and symptoms. And if you've ever had radiation to the chest or, have BRCA, which is a huge one.
Yeah.
So we know Angelina Jolie is a BRCA carrier, and she had a prophylactic bilateral mastectomy, meaning she actually removed both of her breasts because her risk of breast cancer was so high. And that's really becoming the message to women, that even though we love our breasts and it's part of our womanhood, we cannot be so tied to it that if we need to have a mastectomy or, remove the breast tissue, that we lose ourselves, as a woman because of that.
Yeah. And that's 100%. Never, ever, ever think about yourself like that. You are stronger than you know. And so early detection is huge. Not assuming because you're young that you could not be affected by it. That's another huge one. Even if you're a man. Always knowing your own body and making sure you're doing the checks and all the details and resources. Maybe get the calculator out and see, so that if you are above that 20%, start having those conversations. And believe me, your doctor's heard and seen it all. That's one thing I'm like, if you think you're going to embarrass your doctor, not going to happen.
No, in fact, your doctors want you to have that conversation because they're so busy. They've got 10 minutes with you. They're trying to fit in everything.
Yeah.
So, and you know your body. And so if you open that door, I promise they will walk through it very, very happily, because they want to bring up these types of conversations. And I think cancer and preventive screenings is something we can't talk about enough.
Yep.
And because we're living longer, our risk of cancer is going up. But if we get smarter than the cancer, we get ahead of it, we screen ourselves, I think we really can make a huge difference.
And that's every single life matters. And I'm telling you, when you go in and it's something that they can help you with, you're going to feel really good about doing your homework and making sure that you're taking care of yourself. So take care of yourself, not just in October. You should do it every month. And the mammogram every year, depending on your, for the average person, average woman, average man. So make sure that you're checking that out for yourself. Dr. Coley, you'll see her on 9 News all the time. Thank you so much for coming in. It is KOSI 101.1 in October.